I'm Olivia Fierro. You know, an apple a day keeps the doctor away, or so they say, but so could the wrong insurance, not being able to get in to see someone when you need to, say during cold and flu season, the list goes on and on. This morning, Dr. Thompson makes a house call to help you find Dr. Right, so you have someone to see when you really need them. Good morning, Arizona. Getting the names of area doctors may seem easy enough, but how do you know you're finding the right doctor to really fit your needs? Not to mention your insurance coverage. You don't want to find that out on the back end, right? Dr. Sharon Thompson is joining us this morning with a great segment, How to Find Your Doctor Right. Because we often say when we get to speak to you, how lucky it is for your patients to be able to have somebody who really wants to communicate with them, really wants to nurture that relationship and make sure that you're confident about your health care. How do we all find that?
Absolutely. It is so important to find that doctor that you trust and who has a rapport with you that you can tell the truth.
Okay, yes.
Because, you know, a lot of people don't feel comfortable enough with their doctors to really share the real story. And so the first part of it starts with doing your homework. Okay. And the most important homework you have to do is about yourself. What's important to you? Is it a doctor's credentials? Is it where their office is located? Is it that they run on time and you get into your appointment, you know, right on the dot. So you have to figure out what things you value. Also, how do you use the doctor? Do you just go once a year and you pile everything into that one visit? Or do you tend to be, you know, the model patient like my mom and do everything your doctor tells her to do? So you have to really know yourself. And then, so the first place I recommend you start with friends and family.
Okay, yes.
Talk to people about who they know and who they like. People who are your friends tend to be people who are like you. And so you're going to probably have similar preferences. That's a key place. Get those recommendations.
Do you trust online referrals or, you know, the reviews that you'll see on a website?
I would use them with a grain of salt. If they're all good or all bad, that's a problem. You expect to find a mix, and you want to find a mix where it sounds like truth. And that mix sometimes gives it that credibility. If every single review is 5-star and only glowing recommendations, then you have to wonder, who wrote these? Because that's what I would do.
Yeah, a little too good to be true. How do you make sure that you're getting that, I guess, attention that you need in the doctor? We've all been to doctor's appointments, especially during cold and flu season, where somebody doesn't even look up from that laptop. They're entering in the symptoms, okay, and you're in and out in record time. I mean, you've waited in the waiting room longer than the appointment.
And unfortunately, in today's healthcare environment, that is all too common. And it's really unfortunate because, like I said, the relationship is so important. So trust your instinct. If you feel like your questions aren't being answered, if you leave and you say, wait a minute, I didn't get treated for the problem I came in for, then trust that instinct, and you have to keep looking. You haven't yet found Dr. Right. Dr. Right is going to be someone who listens, who makes eye contact, who values that relationship as well, and who gives you the time. Sometimes you can't get in and out in those 6 minutes that Dr. Right has allotted to you. Sometimes you need 20. And Dr. Right is a person who will sometimes take that 20 minutes when you need it.
Okay, yeah, I love that. And then you'll really feel a lot more confident moving forward with your health care.
And cared for.
What about, so you see the MD versus DO. What does that mean in terms of treatment style? Because I know there are a lot of people who want to go to the doctor, we want to get a prescription. We feel like we know what cures us ourselves. And then there are some people who want a bit of a more holistic approach.
And so the MD-DO difference is not as big as it used to be. I would say 50, 60 years ago, there used to be a big difference. But now the training for both those paths is very similar. DOs will have more of an approach that takes into account your skeletal alignment and has a little bit more toward that bent. But they're really very similar. You can get the same sorts of evaluation and management from both. Where you might see a difference is if you picked an ND, and as a Nancy, because naturopathic doctors are trained in herbs and acupuncture and more what we call alternative medical therapies than either the MD or the DO. All three, you still have to do your homework. You have to do your homework.
Dr. Thompson, thank you so much. You can find Dr. Right at Central Phoenix Obstetrics and Gynecology. Thank you.
Thank you, Olivia.